Okay, so I want to talk a little bit about trauma's impact on development and the brain at an early age. And the concept that I want to highlight is the critical window of development. So, as the brain is organizing and learning and kind of adapting to this is what the world is like, and this is how I experience the world, and it's taking this information in and it's prioritizing these early or new experiences. We have to recognize there are specific times, these critical times, these windows during development that when trauma is introduced, okay, to these times, it's even more disruptive than at later points of development or at areas where, let's say, parts of the brain have already started to form and neurons have, already started to connect. Okay, so let me explain it in a different way. So if we think about a house being built, right? Let's say a foundation is set and there are no walls yet. When the foundation is poured, and let's say it's concrete, right? When the foundation is poured and it's concrete, what is a critical window of that foundation? Well, it needs time to sit and it needs time to dry and it needs time to harden. After it is hardened, you can actually start putting the walls onto a house, right? So what would be a critical window is if the foundation is still wet, then it could be molded, influenced, changed, and that would forever change then the next part of development. So that's the part I want to kind of highlight, that an organizing brain, as it's getting exposed to these new experiences, it is extremely sensitive to the output from the environment. So these critical windows, and I'll give you an example, right? Like language development through hearing. Perhaps if trauma is introduced, and I will say severe neglect is a really great example here. Severe neglect with language development is a huge component, right? Let's say that they are not getting talked to as children. They're not getting stimulated. Well, what happens? We have to hear and engage with the world in order to learn. And so then language is then often delayed. What happens when language is delayed? Other areas of development are delayed. Recognition, patterns, attachment styles, because then, especially with neglect, they're not getting some of those relational components. So you can see how these critical windows have a huge impact on normal brain development, because when we have brain development, we're also having these neurons and connections that are expounding exponentially through this entire process. And so we have to recognize that these signals and activities have specific timing in the developmental cycle. So when trauma is introduced, it steals from the next window and it impacts even the ability to move forward. Now, a really important part that I want to highlight here too is if the brainstem and the midbrain develops in a less than optimal fashion. Okay, what does that mean? If they're delayed, because we know that neurodevelopment is sequential, if these things are delayed, that means other areas, other regions of the brain will not be developed. They will not be developed fully, or they will not be developed to their maximum potential. This is also seen if we think about trauma in the womb, right? Trauma as a newborn. I would also say individuals that are born premature, their bodies have not developed fully. Sometimes they need a lot of help just to survive on the outside. And so because of that, they might have a delayed pattern of development. And so they may need a lot of extra care to get to that level of development, right? So I want you to think that's physically. Now take it to an emotional standpoint as well. Language, attachment, recognition, that sense of trust in the world, all of that can be impacted. So trauma has so many levels to this. I want you just to start thinking that this impacts how we think about intervening, treatment, community programs, everything around it. So it's really important to understand some of these concepts.